I know many students and their families are wondering about coming back to campus in the era of COVID-19. And we know that this is an area that's changing daily and weekly. But what I can share with you is that at USC, we've all been working very hard on making sure that we can have our students back in the fall, and that we can protect the health and safety of our community when we do that. USC works very closely. We've had teams working all summer on this, not only drawing from our experts here on campus, our faculty and our staff, but also working in close collaboration with national organizations such as the American College Health Association and our local public health authorities. As students are coming back to campus, and as students are arriving for the first time on campus, we know that things may look a little bit differently than they may have in a typical fall. And this is where we really want to engage our students and our families in being proactive participants and being part of the solution here on campus. It's really important that we all think of and understand the role that we're going to need to play in preventing the spread of COVID-19. Some of the things that students might expect and students will get more instruction about as they come back to campus are the principles of physical distancing and hygiene. Throughout our academic programs, our dining halls, our residence facilities, we are putting in systems for physical distancing to ensure that when people are gathered together, that 6 feet space is between them. We will be requiring our community members to continue using face coverings during the fall time. We also, students can expect to see reminders as they move around their days about hand sanitation, about using wipes to clean their personal spaces. We know that with all of these efforts, it's very important as well that students maintain not only physical distance, but avoid gathering in groups. So unfortunately, this fall, many of the large events, parties, games that might be part of a normal social experience at USC are going to be limited in many ways. We are confident, however, that for our students' creativity, gathering in small groups, the learning, the remote instruction, our students are going to have an amazing experience here at USC, even though it may look a little bit differently. One of the hard things to think about or to imagine, but I want to have a real honest conversation about, is that we know that we're going, with all these measures in place, we're going to have students, maybe staff and faculty who develop COVID-19. When that happens, we are going to ask individuals, let us know. Students are going to be asked to check in with us every day via a mobile app about whether they have symptoms. When they have symptoms, we're going to ask that they come and get tested. And when someone tests positive, we will work to support them so that they can isolate themselves in an appropriate location, making sure that they have food and emotional and support that they need. It may be a really new and challenging situation to have to isolate for a period of as much as 10 to 14 days by themselves while they're recovering from COVID-19. And that's something that I encourage families and students to have a conversation about what that might look like for them if they were to be infected and need to go into an isolation location. We also are prepared here on campus when we have a student that tests positive to do what we call contact tracing, to identify the people and the spaces that they may have come in contact with. In many cases, for our students living in on-campus housing, that may include suite mates, floor mates, other individuals. Those individuals who have had close contact will be also then required to quarantine, to isolate themselves so that until a period passes that we can determine that they themselves are not going to be infected. Some of those very same things we talked about what it was going to feel like and what we need students to be able to do as far as quarantine is an important conversation for families to have this summer as students think about coming back on campus. We know that these measures are absolutely necessary. We want to create a safest environment for everybody that's here. But these are some of the really kind of unique things that we know are going to be in place this fall for students. You can expect more information coming from campus about these various aspects. The last thing I'll note about it is we know that we have some students who may fall into one of the medical categories that we consider higher risk, meaning that if they were to contract COVID-19, their risk of severe disease might be higher than another individual. It's important that students with chronic health conditions talk with their physicians and their healthcare providers about their risk should they contract COVID-19. And make decisions accordingly about where's the best place for them to live. As well as the university will continue to be offering remote options for instruction. And we know that for certain individuals, that might be the best option for them.
Yeah, so in addition to some of the physical impacts of COVID, as we all know that there's some pretty heavy psychological impacts as well, and at Student Health and also the Department of Psychiatry and Behavioral Sciences, we want to make sure that the students know that they're supported and that we're here for them to help them cope with any psychological needs or just the general situation that we're in. And so any student who's been diagnosed with COVID, as Dr. Van Orman mentioned, as they're kind of getting their care, we have medical providers, nursing providers, as well as mental health providers that will be checking in on the students to make sure that they're okay. In addition, students who are self-isolating, it could be pretty tough to not be able to participate in your normal routine, be able to connect with people in the way that you're used to, or being in a confined space. And again, we have services for those students where we have medical, nursing, and mental health providers reaching out to those students to make sure that they're okay and offer any support and emotional coping skills. Outside of that, just in general, we're in extraordinary times. It's a very difficult time for our nation and world. And so we want to make sure that students know that we're available to talk about whatever that they need to talk about. And there's many different ways that students can access us. Of course, there's traditional therapy where students can call and get an individual appointment with a therapist. We also offer group therapy. In addition, we have what we call our Let's Talk drop-in program, which is more of an informal way for students to get support. So a student can call whether they're diagnosed with COVID, whether they're in self-isolation, or whether they're just kind of just dealing with life and wanting to check in. And we have counselors available throughout the day where a student can just drop in and get some concrete coping skills and support to help deal with the anxiety, the doubt, the stress, the grief that many people are experiencing during this time.
So I encourage all students to consider how they might cope with a need to isolate or quarantine, and particularly here on campus to do so by themselves. Families and students might want to have a conversation. We know that there may be some individuals where that might create a significant level of anxiety or might be challenging for them. Those individuals may want to consider whether they would want to stay in their family home for the fall semester versus coming here on campus. And that's a very smart potential decision for individuals to make because that we would not want, we want to try to help students know that if that happens and they are exposed and they need to isolate and quarantine, that they're in the best location to do that. And we know that that's not right for everybody to do that by themselves. I'm excited to welcome all of you here to USC this fall, whether it's in person or remotely. We're working hard this summer to get ready for you to be here. When you arrive on campus, you can expect to see a range of services. We're here to provide your in-person medical and mental health care. We have telehealth services available. We're here to make sure you've met all your immunization requirements. We're here to support the early recognition, screening, diagnosis of COVID-19 to prevent it from spreading to our community. And we're here to give you your flu shot, which is incredibly important this year, particularly in the era of COVID-19. We're looking to see you here on campus. Dr. Leeks?
We can't wait, whether you're joining us remotely or in person, and fight on.
Fight on.